My name's Dr. Rhiannon Davies and I'm one of the GPs here at Bevan's York Street Health Practice. I'd like to speak to you about the COVID vaccination. Many of our patients have already been vaccinated against COVID, which is great because we know it's protecting them against becoming seriously ill from the virus. We know that across the UK, many thousands of people have been saved because of having the coronavirus vaccine. We want as many of our patients as possible to benefit from having the vaccination, and we'd like to speak to you a bit more about this. COVID vaccination is free of charge here in the UK, but we know that many people still haven't been vaccinated, and we've talked to people about why it is and what their concerns might be about the vaccination. We've heard that some people have concerns, maybe thinking it might cause them harm or some side effects, and I'd like to talk a little bit more about that now. As one of the doctors working here at Bevan with York Street, along with the team, we've been involved in the vaccination programme for the past 12 months. Over that time, we've kept up to date with the scientific information, and we've learned more about how it works and how safe it is. So, to help you decide about having the vaccine, here are the top 6 things we want to say about the vaccine here in the UK. Number 1, we know the vaccines work. The vaccine helps reduce the chance of you getting COVID, and alongside that, if you are exposed to COVID, it reduces the chance of getting seriously ill or even dying from the virus. We know that people who are vaccinated are 60 times less likely to end up being seriously ill in intensive care compared to unvaccinated people. The COVID vaccine won't give you COVID. It works by giving you a small amount of a harmless form of the virus so that your body learns about the virus and can protect you if it is exposed. The COVID vaccine was developed much faster than vaccines have been in the past. This is because there was much more funding made available, and researchers, scientists, doctors, manufacturers, the regulators, everyone worked together to get the vaccine out as quickly as possible. We didn't have to wait a long time for the clinical trials because there were many thousands of people ready and waiting to volunteer to test the new vaccine. The vaccines are safe. We've now given more than 9 billion doses worldwide, and we know that serious side effects are thankfully exceedingly rare. You're much more at risk from developing complications from COVID-19 than you are from the vaccine. It's safe to give in pregnancy, it's safe when you're breastfeeding, and it doesn't affect fertility. And in fact, when you're pregnant, it's even more important to have the vaccine, because unfortunately pregnant women are at greater risk of complications if they get COVID, including premature labour and stillbirth. The main side effects from the vaccine are getting an achy arm, feeling tired, feeling generally headachy and achy. And these last just a few days, no more than a week. There are some more serious side effects. Blood clots, heart inflammation and allergic reactions have been seen, but this is thankfully exceedingly rare. It's never too late to get your vaccine, whether it's your first dose, second dose or your booster. These are the ways to book it. You can book through the NHS either online or calling 119. You can book directly with your GP, or you can go to one of the drop-in clinics, and in Leeds the nearest one for our patients is at the Bevan Centre in Hare Hills. Whilst the vaccine is really important, there are still other things you can do to protect yourself, and that includes continuing to wear a mask and trying to keep socially distanced, particularly when you're in a public space. It's important to get the full course to give you the best protection against the virus, particularly currently with the Omicron variant. So for adults over 18, that's 2 doses 8 weeks apart, and then the booster 12 weeks later. And for children over 12, it's 2 doses 12 weeks apart. Please do think about getting the vaccine if you haven't already, to protect yourself and to protect those around you. And thanks for listening.